Good morning, good afternoon, good evening, depending on where in the world you are, and welcome to this Peace Day webinar on COVID, conflict, and crisis, organized by International Alert. My name is Wale Oshofisa, and I will be moderating this event, which will be looking at the trends in COVID and conflict, what peace builders are doing now to respond to the pandemic. We will also be looking at what the coming year has in stock for us regarding the global context and the intersection between COVID and conflict. We will also be drawing on expertise from Great Lakes and the Philippines. Now, this event will take place in two parts. The first part will have presenters from Alert, speaking to the themes I've just outlined. And the second part will be your questions. We'll take your questions. We'll take as many as we can. You can also ask your questions in the chat function below. You can also tweet your questions to @intalert. I'll spell that @INTALERT. We will also be keeping an eye on that on Twitter. Before I introduce the panelists, a couple of things to note. We will be recording the event so that we can share it online for those who couldn't make it. And just as a reminder, please feel free to ask your questions at any time in the chat during the event, and we will get to as many as we can. Now to the panelists. We are quite lucky to have three peace building leaders, experts with decades of experience to start off the discussion. So I'll just quickly introduce each of them. So here we have Cindy Chongong. Cindy is International Alert Africa Regional Director. Cindy joined International Alert in June 2017. Prior to her current role, she was country director in Nigeria until December 2019. Before joining Alert, she worked for several years in the peace building sector in West and Central Africa, the Sahel, and the Democratic Republic of the Congo. During this time, she worked on a range of issues, including youth and women participation in peace building, community-based conflict resolution, countering violent extremism, security sector reform, sustainable business practices and land rights, elections, and conflict sensitivity in humanitarian and development practice. Joining Cindy on the panel is Nikki De La Rosa. Nikki is Philippines Country Manager for International Alert. Nikki has over 2 decades of professional experience in political economic research and program management, working with international and local NGOs, including the academia as well. Before joining Alert, she led the Peace Building Information and Education Services of the NGO Alternate Forum for Research in Mindanao. She was also a research associate and learning center coordinator of the University of Philippines Open University between 1996 and 2008. Nikki is an award-winning author. Her article titled "Robustness in Data and Methods, Scoping the Real Economy of Mindanao," which featured as a chapter in the International Alert publication Out of the Shadows, Violent Conflict and the Real Economy of Mindanao, won the 2017 National Book Award for Social Science. Finally, we have Mike Young, the Chief Executive Officer of International Alert. Mike joined International Alert in September 2019. For 2 decades, he has been working with people and communities dealing with the consequences of conflict and displacement. Prior to joining Alert, he worked for 4 years with Mercy Corps on thought leadership and crisis analysis, alongside postings as Iraq Country Director, Middle East Regional Director, and Regional Coordinator for Yemen. He previously worked for over 18 years with the International Rescue Committee as a field manager, technical advisor, country director, regional director, and senior advisor on strategy. Welcome to the three of you. So Mike, let me start with you. Can you give us a 5-minute summary of where we have been, in the age of COVID, if you like, including the critical challenges and how the international community has responded?
Thanks, Wale, and thank you for agreeing to chair this webinar. And hello, everybody. Happy Peace Day. All right, so that's managing expectations at the outset, Wale, right? 5 minutes to talk about that.
Yes.
Kind of simple subject.
Before 5 minutes.
All right, so 5 minutes. I got this is necessarily going to be at headline level, right? So, and quite often reminders of what's obvious to everybody working in peace building. And I'm corralling the critical challenges really into 4 kind of very imperfect groupings just to help us get through those headlines. So number 1, uncertainty, right? Number 2, universality. Number 3, complexity. And number 4, disproportionality. And I'm quite proud of myself having been able to say that word on a webinar online. So number 1, right, uncertainty. I think we all know that, right? I mean, almost a year since the kind of serious emergence of COVID-19, we know a lot more about the virus and its impacts, but great uncertainties remain. And so what do I mean by that? So let's take the example of the prevailing narrative about the impacts of COVID-19 in the continent of Africa, right? So kind of, if you look at the kind of top level story, the real question is, why is COVID-19 not having as severe an impact in Africa as was kind of anticipated, right? But if you look below that headline, there's a lot of nuance to that, right? A lot of uncertainty. First of all, Africa isn't a single monolithic mass. Obviously, it's a vibrant community of nations and peoples, right? With variegated impacts. You know, so there are cases rising, for example, in the Maghreb, in Morocco, and Tunisia, in Mozambique, while cases seemingly are decreasing in Algeria, in Egypt, and Burkina Faso, to name a few, right? But all that variability, which you would expect in such a diverse and lively continent, right, is underpinned by a general lack of testing and a general lack of reliable contagion data, right? So basically, it's a great degree of uncertainty. But if you look at somewhere like South Africa, which is one of the African nations most impacted so far by COVID-19, you could see now they've done, you know, that their health data is pretty reliable, and they've done a kind of calculation of excess mortality over the COVID period, and they've seen a 59% increase in excess mortality over that period. So obviously it's having a significant impact, but it just underlines really how uncertain our key assumptions and judgments can still be 1 year in. So that's number 1. Number 2, universality. So again, stating the obvious, right? This is a crisis everywhere and all at once, right? There's pretty much no area of the planet that it isn't in some fashion impacting. So, for example, for states struggling with conflict and violence, that universality of the pandemic compounds its direct impacts, right? So you can think of things like the $110 billion drop in remittances, right? And the economic effect that has. Domestic and cross-border supply chain disruption, the effect that has on the economy. Increases that we're, you know, already seeing the hard evidence for increases in kind of all forms of violence, including domestic violence, intimate partner violence, gender-based violence, and this kind of inflammation of social distrust between citizen and state, increasing instability. And, you know, for states kind of in the global north as well, I mean, including donors to aid and peace building, this is, you know, there's a strained balance, right, between domestic counter-pandemic responses with the ability to effectively respond at an international level at a time of economic shock contraction globally. And so lastly, I think for me, the universal nature of the pandemic also means it's kind of that perverse fact, right? We have a global pandemic that's hitting us at a time when multilateral norms and institutions are kind of being degraded gradually. And that the COVID-19 pandemic, rather than kind of net having an effect of bringing us all together in a greater multilateral effort, is in fact seems to be in some aspects degrading those norms, including, for example, one can think of the recent kind of flurry of coverage around vaccine nationalism. So number 3, complexity, or what you might think of as intersectionality, right? It's the entanglement of all the things that the pandemic impacts. So this is, again, stating the obvious, right? This is not only a global public health emergency, but a multidimensional crisis. We all understand that. So two kind of vivid examples of that for me. So one of complexity, right? So if you look at ACLED, and ACLED, of course, is one of the leading conflict data analysts outfits, right? ACLED did a recent analysis of conflict patterns to date in Africa to see what impacts COVID-19 had had. Their analysis is really interesting. It shows that there hasn't overall been a net increase in conflict on the continent yet, but there are worrying changes in the patterns of the violence that's occurring. So we look at things like fighting surging in the areas that where fighting was already the heaviest, right? One thinks immediately of Libya, for example, or for Cabo Delgado province in Mozambique. You have essentially government-sponsored violence suppression under the cover of pandemic lockdown policies. You have violent armed groups, including armed extremist groups, expanding their territory, exploiting the kind of social divisions that the pandemic engenders. And then ACLED are seeing what they characterize as 25% increase in what they call inter-group clashes, right now. So that's an example of complexity. I think an example of the intersectionality of it is the global food insecurity crisis, right? So if you look at World Bank data, data show that global food supply chains and key commodity prices are actually surprisingly resilient, right? In the face of the pandemic. It's when you look at country level that the real impacts are shown. So you have country level food supply chain disruptions, and that's compounded with other economic shocks, such as drop in remittances, broken supply chains, price spikes of key commodities, enforced coping mechanisms like farmers being forced to consume or utilize the seed they were keeping back for next year's crop, for example. All of this degrades food security, and it's driving a significant spike in food insecurity, particularly in fragile and conflict-affected states, to the extent that, of course, the World Food Programme is predicting 130 billion people at risk of acute food insecurity. So number 4, disproportionality. So what do I mean by that? So the pandemic in broad terms, again, it hasn't yet ignited new conflicts, but it has this peculiar propensity to inflame existing conflict dynamics and social fractures and impact marginalized and minority groups most heavily. And you see that range of impacts across both the global north and south, and you, again, increase in domestic gender-based intimate partner violence, compounding of existing public health and public service access inequities for marginalized populations, excluded populations, the disproportionate economic impact of both lockdown policies, price spikes, market disruption for excluded groups, and this whole area of a kind of othering and hate speech and disinformation rooted in the pandemic but directed at marginalized groups. Thank you, Ella.
Okay, thanks, Mike. So uncertainty, universality, complexity, and disproportionality as well. I think I did well in pronouncing that as well on Zoom. Thanks, Mike. I'll come back to you, Mike, but before you do that, I want to turn attention to Nikki and Cindy. I'm going to ask you both the same question, and I'll suggest Nikki to go first, also 5 minutes each. So in your context, what are the challenges and consequences of COVID in Great Lakes, in Philippines first, then Cindy in Great Lakes as they arose, and how as peace builders were you able to meet these challenges, and what specific impact did you and your team have? So, for example, changes in government response, or things to do around risk communication and community engagement. So Nikki, you can go first, then Cindy.
Thank you, Wale, and good evening, everyone from my side of the globe. It's an honor to be here, and it's an honor to share our experience from the Philippines. And I would suppose the discussion of Mike, I will be able to give some specific examples on, things that he talked about in terms of disproportionality, universality, and uncertainty. I can say from the Philippines experience that we took on the challenge of COVID-19 from the beginning of the hard lockdown in March. With a certainty probably accorded to us by our long-standing work on the ground. The main challenges, as with everywhere else, I suppose, include being cut off basically from everything, from communications, from access to livelihoods, the real threat, for example, of physical survival of our staff and our local partners. And essentially, the main question for us was, how do we operate in conditions of lockdown? But I suppose the Philippines Country Office, I can say we were prepared for this type of emergency. And I will say this with a caveat, that the combination of elements, and why I say so, and quite boldly, may be unique to the character of the Philippines office. Now, I'd like to share some of those. Now, for one, we have been operating for quite a long time in the Philippines already, for more than a decade, in high-risk and fragile areas of Mindanao and in Muslim Mindanao. and the programmatic anchor on our understanding of the causal dynamics of community-level conflict and how this interacts with other sources of violence have been a sustained focus. And so therefore, it made us well-placed because we can easily look at linkages of these causal dynamics to the different types of crises as it unfolded. Another aspect of this is our possession of what we say interoperable platforms. For one, we possess panel data. We have conflict monitoring system that looks at the tracks and monitors incidents of violent conflict, incidents, causes, actors, location. We have access to critical events monitoring. We have access to real-time information in terms of tensions and flashpoints or critical events on the ground from our partners. And lastly, we possess a methodology called resource use and management planning, where we use mapping technology in combination of our access to our data set and the facilitation and the bridging of conversation and dialogue between communities and local governments or the private sector in looking at resource use and how to mitigate the conflict impacts of those utilization and exploitation of resources. And lastly, I would say, Wale, that, and this is probably the most important, is that we have access and strong relationships to important social networks at multiple levels. At local government level, at the level of the clans, we have access to our early response networks across the Bangsamoro and the major urban centers of the National Capital Region. We have access to the wide network, our network of women and youth. We have access to national level bodies and champions at the level of legislation. I emphasize this because in the absence of our access to these important social networks, I cannot imagine being able to do what we were able to do as quickly and as effectively as we could. All these combined allowed us to respond better given the limitations. And I won't overextend the success of our efforts because at the end of the day, we were still limited physically and in terms of resources. But nonetheless, we were able to successfully and immediately deploy in the first week of the lockdown detailed area maps to local governments in Muslim Mindanao. We tailor-fitted the data that we already have from our RUMP. And these were useful for local governments for emergency planning, for deployment of specific responses, for monitoring of vulnerable areas and the hotspots of the disease. Also, we were able to immediately expand our critical events monitoring. So we were able to monitor incidents, COVID-related incidents, such as physical, social, economic, and security threats arising from the pandemic. Now, we made sure that we published regular bulletin to bring to public attention and pressure to issues such as discrimination and cultural insensitive measures. Now, we were able to monitor, for example, bullying and intimidation by security auxiliary forces, or the absence of protocols that apply to sensitive cultural rules in the handling, for example, of the sick and the management and disposal of the dead, especially of Muslims. And one major result, I would say, of amplifying this issue of cultural insensitivity and our lobbying of key political actors in Congress was the issuance of a national directive by the Department of Interior and Local Government on guidelines on the management of human remains for COVID patients. And within that directive is a clause, a provision for special considerations in respect to various religious and cultural practices. This prohibited local governments from restricting the family of a Muslim who died of COVID to conduct Islamic burial rites, which was what we monitored before this directive. The bulletins also became a good analytical resource for donor communities as they were also developing their own response, given the immediacy of the situation. And lastly, and perhaps this is a good evidence that what we did may have had some important value, are new demands for our expertise, to harness our expertise. For example, in the national effort on contact tracing, this was a direct demand from the head of the national contact tracing of the country himself, particularly on the use of geolocations for visualization of data. quantitative analytical methodologies that would be useful, and enhancement of data management protocols. Other demands included bespoke information and feedback platforms so local government can easily, efficiently deploy information to their constituents, to get immediate feedback, to monitor critical issues and events, and to be able to respond to this immediately. And lastly, from the Department of Education in one of the provinces in Muslim Mindanao, they requested us if they can adapt our two-way radio network and the structure of that network for teaching and learning of elementary and high school in this period of modular delivery of classes. So those are just some of the examples, Wale, of the results of our efforts and the efforts of our partners on the ground in the last 6 months.
Thank you so much, Nikki. So, part of the things I picked from what you're saying is, balancing the challenges with the successes that your team has managed to achieve, and the importance of having conflict monitoring system in place, access to real-time information and data for effective planning, and strong social networks. I think oftentimes we forget about the importance of having very strong social capital in communities where we're working. So the strong social networks you have with the local governments, authorities, and the clans as well. And finally, the strong advocacy that your team managed to put in place for policy changes around how human remains are managed in a Muslim, predominantly Muslim community. I'll come back to you with some additional questions, time permitting. I want to turn to Cindy now to walk us through some of the challenges, consequences, and the impact of our team's work in the Great Lakes. Cindy?
Thank you very much, Wale. Good morning, afternoon, evening to everyone. I'm very happy to be able to share with you about our approaches in the Great Lakes. This is a region that Alert has a long history in. We've been doing peacebuilding programming for over 2 decades in Democratic Republic of Congo, Rwanda, Burundi, and Uganda. And currently we're working on both sides of the Rwanda-DRC border, including addressing the cross-border conflict dynamics. So as many of you know, the region is very closely interlinked economically, socially, and politically. And so the history of peace and conflict in the Great Lakes has really been shaped by what happens at the borders, and in particular, the DRC-Rwanda border. So throughout my presentation, I'll talk about specific trends in each of these 2 countries, but also the regional impact. And my colleagues from DRC and Rwanda, fortunately, are also on the line. And so later on, they'll be able to provide some more details if there's some questions from some of you. So in terms of the challenges and consequences, what we really saw was at a granular level, the trends that Mike described earlier. This is one of the most conflict affected parts of the world. So it was not unexpected that the consequences were really quite strongly and immediately felt. In Rwanda, there were very strict lockdown measures, which were successful in containing the spread of the virus, but they ended up having a very significant economic impact. And being a landlocked country, the early and sustained border closures really created a huge economic shock, loss of livelihood, which then led to some increases in criminal activity, as well as a spike in gender-based violence cases as people were confined at home. But also because there was a low understanding and ownership of the restrictive measures at community levels, and a lot of misinformation about how the virus was spread. Initially, there was poor compliance with the measures, and it led to an increase in confrontations between citizens and authorities. And then lastly, it's really important to note that the lockdown measures took place during the annual genocide commemoration, which is a time of general heightened anxiety and tension. And the restrictions put in place meant that we suspended all the psychosocial and peace-building activities, which meant that a lot of people who were experiencing particular trauma compounded by lockdown were not able to receive support. In DRC, the main impact we saw was just generally exacerbating this lack of trust between government and citizens, in particular, the lack of coordinated response and poor communication around the restrictive measures led to increased distrust. The pandemic coincided with a high-profile prosecution of a prominent politician from Eastern DRC, and so his supporters felt the lockdown measures were direct attempts by the government to limit them from gathering. And so there was a general level of distrust over government directives, which meant that measures were very poorly observed and cases spread quite rapidly. An alerts perception tracker, which is a tool that we adapted from our Ebola Response project, showed that there was a lot of misleading information being shared, which led to scapegoating of particular groups. In terms of cross-border dynamics, economically, the countries are very heavily dependent on one another, and so the border closures had an immediate impact on the economy and livelihoods, particularly in border areas. From a health perspective, the countries each approach it in a different way, ranging from Rwanda with very strict lockdown to Tanzania that had almost no measures to speak of. And so the way Tanzania dealt with it then had an impact on cases in Rwanda and Burundi as lorry drivers crossed borders. And then politically at a regional level, there wasn't much harmonization and coordination amongst the different countries, despite the fact that they're so interdependent. And so there's a feeling that diplomatic relations also shaped the policy. So Rwanda and Uganda and Rwanda and Burundi had difficult relations before, and these were some of the first borders to be closed. And that led to the suspicion that, politicians were actually taking advantage of the crisis to advance their interests rather than being concerned about the welfare of the population. And then lastly, on a social level, closing the border meant there was limited contact between groups on different sides who have long been in conflict, and that the lack of social contact damages social cohesion, especially in a context where there's hate messaging with a lot of misinformation about certain groups being responsible for the spread of the virus. So how were we able to meet the challenge? Well, it was a huge challenge for us to, first of all, be able to adapt our programming. So as peace builders, we pride ourselves on being flexible and adaptive, but it's one thing doing that in a conflict context and another being confronted with this unprecedented global pandemic where almost everything about how we're used to operating ground to a halt. So our response was mainly around adapting our existing tools and developing new programming and also using existing programming to address the conflict and social consequences of the pandemic. So as I mentioned earlier, we have this Ebola Response project in North Kivu, where we have a perception and community risk tracker, and we adapted that to also be able to measure changing perceptions among communities about COVID-19 to increase our own understanding of the context, which then shaped how we adapted our programming and how we developed our advocacy. And we did do some targeted advocacy towards government agencies to be more sensitive to the realities and needs of communities, particularly women cross-border traders, which is a group that we work with in Rwanda, Burundi, and DRC. And particularly in DRC, we did advocacy and we brought the government together with these women traders to understand what their needs were and developed an action plan to support them, for example, through setting up group purchasing mechanisms and allowing them to be able to conduct small petty trade across the border, even though the borders were officially closed. And in Rwanda, we also used our community links to address some of the misinformation around coronavirus. So using radio spots, using community mobilizers to share information among the population. And these are mechanisms that are trusted. And we also recognize that the support to trauma survivors is critical and that they're more isolated and vulnerable under lockdown. So we were able to use our trained community mobilizers to continue to provide one-on-one psychosocial support in communities and to also hold meetings with local officials to talk through how they could adapt some of the restrictions to be more sensitive to the context. And finally, we've just launched a targeted program on COVID-19 response in the Great Lakes, and our role in collaboration with Internews is to address the challenges of misinformation and that trust deficit between citizens and state. And so this project is going to work through community structures to inform citizens on the pandemic, but also develop recommendations based on citizen engagement for governments and other actors on implementing their response in a more conflict sensitive and inclusive way. And finally, we'll be working with early warning structures that are already in place to integrate COVID-19 indicators to understand how this pandemic is having an impact on community tensions and conflict triggers. I'll stop there because I've gone way over my time. Thank you.
Thank you, Cindy. That was very, very rich and very, very detailed understanding of the context in the Great Lakes. For me, we can see some common threads here, right? We can see, a relationship between the lockdown, economic dislocation, heightened tensions, which then, also affected ability of your programs to provide some psychosocial support. The key issue of poor communication, that seems to be, constant across, I think it's a global thing, right? Poor communication leading to increased distrust between various communities. There's also, looking at the cross-border implications for, the DRC and Rwanda. Those of us that have been following the Great Lakes for years understand the complexities, between those two countries, and what happens across the border and the impact it has on economic activities. It was good you talked about the innovative approaches that your team has been has put in place to tackle these challenges. And one key one that came out for me was the constant reference to risk communication and community engagement as key, to mitigating tensions and getting the right information out to communities so that, you can begin to limit the mistrust. Mike, I want to come back to you, if you don't mind. Again, looking at the bigger picture, what has changed and what will likely remain the same in 2021?
Thanks, Wale. Again, I will attempt to kind of headline answer and leave quickly to leave the kind of granular detail to my colleagues who actually know what they're talking about, Nikki and Cindy. So again, I think for me, the big flashing neon headline, right, the big one is uncertainty. So not least in the basic parameters of the pandemic, right, scale of impact, duration, when and how vaccines and treatments might be available, effective, etc. Especially for people in kind of extremely vulnerable and poor communities at the sharp end, right, in fragile and conflict affected states. But I think we can expect, right, many, if not all of the kind of big brute facts of the pandemic and its impacts on peace and conflict to continue to reshape peace and conflict along the same dynamics as they're currently doing. And given that, I think there are kind of three big strategic things everybody needs to pay attention to, whether you're a peace-building organization, a donor, a policymaker, etc. So number one is that peace building is an essential component of any effective public health response, full stop, right? It's not just an add-on, it should be at the heart of humanitarian and public health responses to the pandemic going forward. And not just in fragile and conflict affected states, but in the global north as well. We got to learn the lesson of previous academic responses, including obviously the Ebola responses, about the necessity of which you've spoken to, right? And Cindy and Nikki have also eloquently testified to, the necessity of building trust and the centrality of national and local and grassroots actors in that effective response. Kind of leads to the second thing, which is, put local first responders for peace in the driving seat of any response. So as everybody's testified, right, that's absolutely vital and it shapes the truly most effective response. So it really means accelerating the localization agenda and that kind of really putting in place the resources to truly leverage existing grassroots and locally led partnerships and networks, just as my colleagues from the Philippines and the Great Lakes have talked to, right? And finally, going on number three, for me is we need the triple nexus to come alive. That's a bit more of a technical thing, right? But if anything demanded an integrated response, it is the COVID-19 pandemic, because it's so entangled, right? So many different variable impacts, so much intersectionality. So yet at a time when the triple nexus really is needed more than ever to shape the discourse and the international response, everything's falling strangely silent about it, right? And there's a lot of work and preparation gone into defining the triple nexus. It's there, it's a framework. What's needed is funding and programming to reach across those humanitarian, development and peace building silos and really be locally led and demand driven.
Thank you, Mike.
Thank you.
Yeah, very, I like, the way you brought in the triple nexus. I think that's more of the way the aid system is structured. That it can be an enabler and also a barrier as well. And I think in this time and age of COVID, it should be more of an enabler, not a barrier. Cindy and Nikki, same questions for both of you. And if you can respond in a minute or two, that will be helpful. What will be your top 3 pieces of advice for donor agencies? In other words, what should be done? Nikki, you can go first.
Sorry. First is on ensuring endowment collapse in vulnerable areas does not happen. Areas that have a history of violence even before the pandemic hit, are more vulnerable and maybe actually worse off because of new threats of COVID. And that the main cause of uncertainty and vulnerability of the civilian population rests upon the stability of their endowments. What I mean by this is that their continued access to regular employment, their access to livelihoods, access to welfare, such as education and health, access to productive resources that can strengthen their ability to cope and survive. Or if they don't have access to it can disrupt their daily lives, destroy their endowments, and force them deeper into poverty. And like what Mike said earlier, for civilians living in conflict areas where risks and threats to their physical safety and loss of their endowments are constant, the impact of the pandemic adds another layer to this hardship. So the current pandemic and its economic consequences are expected, of course, to arrest economic growth, boost inequalities, and dangerously widen the human development gap. So we need cooperative efforts to influence sustainable responses among state and non-state actors, and to offset the violent flashpoints that are bound to emerge as the crisis intensifies. Let me give you 2 specific aspects to this. First, we need to strengthen multi-level and multi-stakeholder bodies that include the private sector and civil society, women, youth, community leaders, in emergency response and the autonomous monitoring of implementation. Strong multi-stakeholder push for a comprehensive approach is crucial for long-term preparedness and protection of the economically vulnerable. The private sector can provide quick assistance and have robust systems for service delivery, while local civil society groups and individuals have access to information and can observe tensions at community level, which can therefore inform timely and appropriate action by local government units and national governments, for that matter, including the security sector. We need to strengthen social protection measures targeting the needs of the vulnerable sectors, such as women, minorities, elderly, and people with disabilities. They will need stronger safety nets, including the establishment of separate facilities and the provision of targeted support, financial support in times of crisis. And lastly, and I promise this is not a shameless plug, but there is a need to emphasize support for interoperable and innovative platforms that provide, credible and robust evidence base to be able to inform the development of response, the development of needed programs, relevant programs, strategies, and deployment of specific responses that are nuanced to enduring causes of conflicts at the community level. Thanks, Wale.
Thank you, Nikki. Cindy, the 3 key things.
Yes. I'll try not to repeat what my colleagues have said, because everything they said is absolutely relevant to our context as well. I could just highlight 3 things. So one is what our experience has really showed is that because of that breakdown in trust and communication between citizens and government authorities at different levels, is really a need for inclusive and participatory approaches to tackling the response to COVID, and that communities need to be more involved in decision making and information sharing. But this is not just in terms of this particular outbreak, but speaks to a larger need for more conflict-sensitive approaches to responding to crises. So less of the heavy-handed, really securitized, top-down approaches that we tend to see, and more initiatives that engage local leaders and civil society in the decisions that impact people's lives. Secondly is to look at prevention and preparedness. And so, you know, it's a medical emergency. Doctors will always tell you prevention is better than cure. And a lot of the negative consequences we're seeing now are not just because of the unprecedented nature of the pandemic, but because of the lack of social and economic resilience mechanisms and the fact that response strategies are often being built from scratch. People have nothing to fall back on. So there's really a need for preparedness and prevention work, focusing on strengthening social and economic resilience mechanisms. And then finally, it's that we really need to situate the impact of this crisis in the wider conflict context in which and that we're analyzing in each case. So yes, coronavirus has exacerbated existing tensions and brings its own new challenges, but we can't consider it in isolation. And so as long as we're not tackling the root causes of violent conflict, whether it's poor governance, lack of economic opportunity, trauma and insecurity, etc., we can't expect governments and societies to respond effectively to this crisis nor to future health crises. So I would say this as a peace builder, of course, but it's been really clear from the experience over the last 9 months that we do need to continue to prioritize this longer term holistic programming that addresses root causes of conflict and fragility. And particularly in the Great Lakes, it means we really need to hone in on these cross-border and regional dynamics, which is something that a lot of donors and practitioners really still struggle to deal with. There are language barriers, there's administrative issues, there's political issues around working across borders, but it's become really clear the level of interdependence we have in our world, and particularly in this region, and that we won't be able to get to the bottom of these problems if we do not broaden our analytical framework. Thank you.
All right, thank you, Cindy. We have you know, some questions you know, coming in, and I will encourage everyone online to you know, send in more questions as well, and we'll try to get to as many as we can. Before I go to the online questions, there's a question I have for Cindy and Nikki, and Mike, feel free to chip in as well. Given the challenges of you know, human contact, you know, because of social distancing and, you know, lockdowns, what is the role of technology in facilitating community dialogue in this process? Is there a role? What are the challenges? Are there deficits that we need to take into account? And is that something that donors should also support as well?
You want me to go first, Wale?
Yes, you can. You can.
Okay. Well, in the Philippines, we use and harness technology for our work, for the platforms that I just mentioned earlier. But technology is in itself is not an end in itself, I suppose. The more important thing is for us to understand the information ecosystem of, you know, the different areas. So for example, in some areas we use two-way radio because there's simply no cell site and no mobile access there. In other areas we would use our local partners. This has to be in combination with local people who are there, and even if it's a lockdown, they would still be able to talk to each other, given specific measures at the local level. But I suppose it hasn't, from our experience, that hasn't been removed. And so, you know, you add another layer in the use of technology and harnessing that technology. And we've always, because we run a conflict monitoring system, and I suppose we provided evidence and we demonstrated already the importance of the use of technology in systematizing information and to make sure that, you know, good analysis can come out of systematic gathering of information. And that in itself is one of the importance of technology. And I think the donor community has paid attention to how it can improve access of people to each other and improve communications and address fake news or improve access of people to information as lockdowns happen.
Thanks, Nikki. Cindy, do you want to chip in?
Yes, please. Yeah, it's really been a challenge to us in the last few months thinking about these new ways of peace building and digitalizing our approaches. And actually, in some cases, we were able to do things around radio programming and so on. And we've been thinking, particularly in Rwanda, about how to expand our outreach to YouTube, etc. So I definitely think that it is a challenge that we as peace builders need to meet, thinking about what are different ways that we can connect people. But as Nikki said, it's not about the means, it's about the end that we're trying to get to. So in some contexts, it may not necessarily be the right move to go towards increasing high tech, particularly if you think of somewhere like Eastern DRC, where not many people have access to internet or to mobile phone networks. You don't want to develop this tool that doesn't allow you to do the fundamental peace building work, which is bringing people together across conflict divides. So it's really more about thinking about how do we get that message across, how do we identify people who are trusted? How do we know who has influence? How do we bring the right people together? And sometimes the solution might be low tech, so it might be something as simple as the example I gave in Rwanda of just having a trusted community mobilizer doing one-on-one engagement. So as peace builders, we've always said, you know, the most important thing before you start anything is to understand the context that you're working with, understand the stakeholders and their needs. And from that will flow the way in which you design the tools to reach people.
Thank you, Cindy. So we, again, you know, we just have to be, you know, very context sensitive and context specific. Technology might work in some contexts and it might not work in others. I was in a meeting a few weeks back and we were talking about how to, you know, get the right information to communities, and someone floated the idea, someone in Sierra Leone floated the idea of the town crier system. And a lot of people on the call were a bit confused, wondering what the town crier was. And when it was explained, you know, it was, you know, it's nothing new. It's what has been going on in, you know, communities in Africa for centuries. And it was, you know, if we can tap into that, you know, because the town crier is someone that is well trusted by communities. If you can use them to get information now, that will be very, very effective. We have a lot of questions coming in, but before I, you know, pose the questions to the panelists, just to say that we have two of Alat's peace builders working in Great Lakes and in Rwanda joining us. So we have Lucy Williams, who manages projects in DRC, and Betty Mutesi, Rwanda country manager. Will be joining us, you know, to answer the questions that are coming from participants. I am also going to abuse my power as chair by extending this, you know, session event by 20 minutes. So for those that are able to stay beyond the top of the hour, we will, you know, continue this conversation for another, you know, 20 minutes. There is a question here from Mirinda Hurst, which I think is very, very relevant. And I think the question is for, you know, the practitioners. So are practitioners now seeing programs distinctly being developed to address the trust, social cohesion impacts of COVID? Or is it about integrating awareness and risk communication into existing programs? What as practitioners should we be doing now to ensure these dynamics don't get worse as the pandemic goes on?
I'll start. So for the first question, it's both. In our case, we have seen both requests and a push towards specifically developing programming around responding to the peace building impacts of COVID-19. So I mentioned this regional project we have in the Great Lakes, but there has also been a push, not just from donors, but also internally to think about how we adapt our work. You know, we're not content to just sit there and say, well, there's a lockdown, so we're going to sit in our offices and twiddle our thumbs. No, we've really been looking at how we use the different tools, how we use our relationship with community structures and the trust that we've built up over many years to actually address some of these issues. In terms of what we need to be aware of, I go back to what I said about understanding the context in which we operate and what are some of the existing conflict triggers and what is the interaction between what we're seeing happening with COVID-19 and those existing triggers, and understanding their interaction of our work with those triggers and vice versa, and then shaping our response around that. So if we come in with sort of a preset idea of this is what we need to do, this is the situation on the ground, we might end up doing something that at best is conflict insensitive, at worst actually exacerbates some of these tensions. So there is sort of an incentive to, you know, get in as much new programming as possible, rush and respond to this pandemic. But if we don't take the time to actually understand the environment in which we're operating and the consequences and impact that we might have on that environment, we risk doing a lot of harm. So repeating what my colleagues have said, you know, these basic peace building principles are really, really important in being able to deal with a health crisis like this.
Thank you, Cindy. Nikki.
Yeah,
Nikki,
can I add to that, Wale?
Absolutely.
Yeah,
Please.
I was just thinking that, you know, if your question about what needs to be the focus now, and I think we need to be, at this point, we need to be monitoring residual issues already of the pandemic and its implication to violence, especially in areas that are already vulnerable to begin with. So the depth, so for example, we've been able to monitor polarization, the depth of polarization between geographical areas and between identities caused by, you know, exclusionary actions during the lockdown, and how this can be resolved needs to be a priority. I think this is a transitional justice, a restorative justice issue in light of the pandemic. We shouldn't look at transitional justice in political settlements, but also to extend this in the aspect of, you know, what were the tensions, what were the results of the pandemic. This is already a good time to make an accounting of the grievances, the hurts, the frustrations, the feelings of unfairness and injustice that was caused by the measures of the state or even of the communities during the pandemic. And then secondly, there needs to be a shift from working on solely on violent conflict to working on complex emergencies, like what Mike has mentioned earlier. Not only on humanitarian emergency and civil war as before, but pandemic and the eruption of violence and its interaction with enduring causes of violence, as we've seen as peace builders now. Issues of resources, issues of identity, issues of violent extremism, and so on. The worst that can happen is if these enduring sources of violence will be hidden from public view or will not be part of the public discourse, and that there will be no sustained priority and resources to continue to tackle these issues. And like what Cindy said, we have to be able to put in, you know, a more holistic and a more comprehensive look at, you know, the impacts of pandemic on already enduring sources of violence. Thank you.
Thank you, Nikki. Nikki, while I have you, there is a question specifically for you. How did you succeed to conduct advocacy, media programming, and community mobilization during the time of social distancing?
We used a lot of technology. And like what I discussed earlier, I think we were able to deploy immediately our platforms, you know, that's already existing. So we have early response networks that are already in our system. We have reporters, we have monitors that are already in our system. We were able to make our staff and our local partners as monitors themselves as we were working from home. We used a lot of, you know, technology from the more low tech of just telephone conferencing to the high tech of Zoom. And a lot of, I think, because of the exigency of the need of the situation, I think the learning curve of people in accessing technology is not that steep. And again, I'd like to emphasize that, you know, we were able to do this because we've had long-standing work already. I think a level of legitimacy at the local level. We have social networks, we have wide social networks at multiple levels. And so we harnessed all of those things. We were in possession of data. And so even at the first week, we were able to immediately deploy all those things and tailor fit. But making sure, I think the emphasis is on making sure that what we provided, the local governments or our partners on the ground, civil society, etc., it might be data or it might be access to different political actors at the national level in terms of the conversation about different things at the policy level. We made sure that information that was used was evidence-based and that it is credible and that it has objectivity to it. I think it's important for us to emphasize that in terms of the work that we do and maintaining that legitimacy.
Thank you, Nikki. There is a question there from Andrew Shepherd, and this is, I suppose this is for you know, Betty and Cindy as well. Can you outline in more detail well, as much detail as you can in 2 minutes, the economic and social impacts of the effective lockdown in Rwanda, how these have gone on and how people have coped, what effects has there been, you know, as Andrew is saying, poverty is widespread in Rwanda, and much of it is quite severe. Is there destitution going on as a result of the lockdown? Betty?
Thank you very much, Were. Good afternoon or good morning, everyone. Thank you for inviting me to this A&Q question. And thank you for the question. I mean, the economic impact of COVID in the Rwanda economy has definitely been a bit high, given that Rwanda, as earlier said, is a lockdown country. And so we had really serious consequences. And I think last according to the Ministry of Finance and Economic Planning, we had a 48% decrease in terms of employment, in terms of Rwanda has been depending much on tourism industry for the last few years now. And now, given that there hasn't been any kind of movement, so you could see the hospitality industry and the tourism industry has been really dead for 90% of the industry. The lockdowns has really been, Rwanda is one of the countries in the region that has had really severe restrictions on this. And definitely government very much controlled the spread of the virus, fortunately enough. As of now, we have less than 2,000 active cases. But this has come as a cost as well. It has costed us so many of the income, a lot of unemployment. You could see a lot of hotels are still in the lockdown. And so you sense a level of really frustrations in terms of those who are unable to be back or to be back at work. I do believe that government has put up post-COVID economic plan, and it has been really asking different partners, development partners, to come in and try to rescue particularly the private sector, where they have businesses coming up. Also, they have really tried to come up with a very well-organized system of tracing. So you realize that they don't really cross the whole country at the same time, but they have been really crossing specific districts where cases are being traced. And this has really minimized the impact. The economy, which is also based on agriculture, 80% of the population, this kind of activity has been ongoing still despite of the lockdown. So the farmers have continued to do that. And of course, the impact of chain supply, market linkages from rural to urban setting has been of a huge challenge. So generally, there has been bioeconomic social consequences, but then we notice the government huge, much really in control and trying to minimize the effects that we are getting on the ground. Over to you.
Okay, thank you, Betty. So, Mike, there's a question here for you. How do you see UN military and civilian personnel cooperating or not with NGOs and nation-state security and development agencies pre-COVID? Has the pandemic led to any changes for good or for or for bad? Has there been any changes due to COVID? Mike?
I think to a large extent it's too early to tell, right? So I think where you have like large UN mission or peacekeeping presences, the interaction of that structure with the kind of general kind of international community engagement with any specific fragile and conflict affected country, it's really in its infancy, I'd say, especially in terms of any kind of follow-through effects or impacts on the ground. So I really don't have an answer to that question specifically, because it's, in many cases, even globally, we're kind of still in the first wave of understanding, of impacts and understanding. I mean, we have seen, of course, numerous examples where the pandemic has exacerbated, the lack of trust between government security forces and, citizens in certain areas. One thing's Mali, for example, and where the kind of whole kind of nexus between repressive government security force interactions, plus kind of the presence of violent armed extremist groups or transnational groups, kind of seen those conflicts accelerate, and kind of particularly non-state actors like that being able to kind of basically expand their territory of influence due to the pandemic. But in terms of kind of hard cooperation within kind of mostly through the UN system, I think it's too early to tell.
Okay, thanks, Mike. Lucy, let me bring you in here. Given that, there's a lot of peacekeeping going on in DRC, do you want to respond to the question on UN military and civilian personnel cooperating or not with INGOs and, nation-state security apparatus as well?
Yeah, great. Thanks, Wale, and hello, everybody. Good morning, good afternoon, good evening. No, I think I would echo what Mike mentioned there. I think it really is too early to say, and all organizations, international agencies like the UN as well, have been having to adapt and adjust to this new working environment. So I think it's too early to comment on that. But I think there is a recognition across the board of the need to better coordinate, certainly in Eastern DRC, where we've already been through the Ebola response, the need to have integrated, coordinated approaches that are not just development, just humanitarian, just peace building, but really look to integrate all those different elements. And as I say, that's based on our experience in the Ebola crisis in North Kivu. I think that's all I would probably say to that point, Wale.
Okay, thank you, Lucy. So there's a question here, and I think I will open this up to all the panelists. So the IFIs have offered, IFIs, international financial institutions, have offered significant amount of financial support to governments around the world. Any specific risk to this approach in conflict-affected fragile context? What one recommendation would you make of the IMF and the World Bank? What are the risks, and what's that one recommendation you will make? Who wants to go first? Open floor.
Happy to have a stab at the first answer. Yeah. Yeah,
please go for it, Mike.
Okay. So what's the single biggest risk? The single biggest risk is a risk of absence, right? The absence of a conflict-sensitive approach. Very, very closely connected with a certain deafness to voices from the grassroots and on the ground, right? As Nikki and Cindy have talked about eloquently, those voices that have that credibility and long-standing experience with a vast range of social networks, as you kind of leverage these big beasts of kind of multilateral support, it's really often really difficult for those voices to penetrate right through to those rooms where the policy decisions are made and spending decisions are made. And I guess the third risk would be that, the devil is in the detail of implementation again, and the way many of these good faith endeavors fall down is that implementation again becomes heavily tilted towards multilaterals and does not of necessity have a meaningful involvement of local actors.
Yeah, so there's always this tension where it's very macro national level interventions, and it's completely disconnected from what's going on at the subnational level. And given that international organizations like ALAT rooted in those communities, it will be it's helpful to connect the macro with the micro, what's going on in the community with the macro policy issues. Does anyone else want to add to that?
Just a small bit, Wale. So I think in terms of the World Bank, we can't probably see them as a monolithic organization. I suppose there are pockets by which you can engage to influence their requirements in terms of the social protection or environmental, social impact, whatever, to make sure that this has a conflict lens. And I think we've done that in the Philippines in the sense that because they fund our conflict monitoring system, for projects that involve the Bangsamoro or Mindanao, we get to be harnessed to provide briefings and so on. Even without those requests, we also make sure that our reports or our bulletins, our briefs, our analysis gets to them. And I think that's one aspect where we can actually start that conversation where you provide good evidence and good analysis. We've been able to do that at least in the country level, and the programs that they implement in the Bangsamoro, we're able to lend some influence in terms of the conflict analysis and the conflict impact of those projects and how to mitigate those.
Thank you, Nikki.
I'll just add quickly, maybe my piece of advice is most of these institutions, they now recognize the importance of peace building approaches, addressing root causes of violence, etc. They have strategies. The World Bank this year launched its strategy for fragility, conflict, and violence, which really addresses some of these things we've talked about, understanding the root causes, engaging people in decision-making, etc. So my advice for them would be to use it. Actually, walk the walk. They've been talking the talk, saying the right things, producing these strategies. So now is the time to implement it. There is a lot of pressure to be seen to act immediately and to inject a lot of money and to get moving. But this crisis has shown us that we really do need to have well thought through long-term approaches. So the tools are there, the language is there, the frameworks are there. Let's actually put it into practice.
Okay, thanks, Cindy. Just continuing on that, thread of peace building approaches and putting their policies and frameworks into practice. Mike, let me direct this question to you. It's a question from Megan Schmitz. What's your assessment of where the peace building lens is in response now? The current response now?
In terms of status, application?
Yes.
Yes. I think it's highly variable. As Cindy and Nikki, you pointed out, there are institutions, often like big institutions, who do, have put a conflict sensitive or peace building lens type approach at the center of some of their policies. And there are other big institutions whereby kind of that intensity of pressure is leading them kind of back to the comfort zone, which is much more narrowly defined. So I think, we've been having conversations with a number of different groups right across the kind of humanitarian development spectrum, including, key donors, et cetera, donors with a classic peace building focus, other donors who have a broader multiple mandate, like other agencies have broader multiple mandate, and it's really variable. I mean, I think everybody's wrestled, right, to get their hands around what does it mean to have an effective pandemic response, and the kind of next layer of that is wrestling around the centrality of peace building within an effective public health response, particularly for fragile and conflict affected states. Within the kind of wider context that, we are all committed to the Sustainable Development Goals, right? Right at the heart of them is SDG 16 around peaceful, just and inclusive societies. And the pandemic is having quite a massive impact on the international community's ability to deliver Agenda 2030, this decade of action, full stop, right? And particularly for fragile and conflict affected states, where even before the pandemic, they were really severely lagging behind delivery on key indicators because of that kind of being caught in those cycles of conflict. So really, application of a peace building lens, even at that meta level, is absolutely critical to turning that situation around. So it's in some institutions and groups and donors, walking the walk and talking the talk. In other cases, the message is yet to hammer home.
Right, thanks, Mike. There's a question there on collateral damage, which I'll come back to. But I just want us to stay focused on the peace building lens. And related to that, it's a question for Nikki and Cindy. How are you working with partners in other sectors? For example, in health, in education, in the humanitarian sector, in your countries? Is there any specific relationship that you have with them, in this age and era of COVID?
Like the example that I have shared earlier, I think we've been engaging some aspects of some agencies within government. So for example, contact tracing. It's not necessarily a work of peace builder, but we see this as an opportunity where we can influence in terms of the tools and the analysis that we can introduce into their system, that we can influence putting into their analysis and their response a conflict lens, and to make sure that any actions or any response won't exacerbate existing dynamics. Secondly, we have worked with the education sector in terms of not just harnessing the infrastructure that we have and the two-way radio system that we've built, but also in terms of probably injecting some of the conflict sensitive content into the modules that they will develop, or introduce some of the things that some activities that would have a peace building framework but would be useful for schools as well. So there are a lot. It has been a natural relationship. I've not seen some silos, at least from our context, probably because we have the evidence, we have the technology, we have the platforms, and they don't see us as necessarily just doing peace building or culture of peace, but really looking at hard-nosed issues on the ground. And I think from experience, that has been recognized as important across the different sectors and the different agencies now.
Thanks, Nikki. Cindy?
I would actually like to hand over that question to my colleagues. I think particularly in DRC, we have some very interesting experience collaborating with other types of actors around the Ebola response. So Lucy, if you don't mind, I'll let you take that one.
Sure, thanks, Cindy. Exactly, that's the example that popped into my head too. So International Alert for the last year has been working with health actors and humanitarian agencies in response to the Ebola crisis in North Kivu. And we've been adapting that work more recently so that it's also we're also able to take into account the new COVID crisis. So there, what we specifically do is monitor community perceptions of humanitarian interventions. And that way you can understand whether communities are actually getting all of the information that they need about these interventions and how to engage with them. And through that, we've been able to kind of establish a sort of dialogue of sorts between communities through local health structures and humanitarian agencies and health authorities, so that the needs of the communities are being taken into account by the interventions, but also the interventions can adapt based on the reality of the context that they're working in. So in Beni in North Kivu, this is a context that has suffered from protracted conflict for an extended period of time, and there's a very low level of trust between communities and authorities, for example. So the intervention response from humanitarian actors and health agencies needs to take that into account and needs to really put an emphasis on this, building this community confidence first, in order to have an effective response to that. COVID, and we're monitoring COVID response as well.
Oh, okay. Thank you, Lucy. So the final question is open to all. So Nikki, Cindy, Betty, and Lucy, given you are, in DRC, Philippines, Rwanda, it's from Priyanka. And the question is, to what extent have local governments been addressing the collateral damage from lockdown? And how has this impacted peace-building efforts? Who wants to go first?
Well, I can jump in if you like from DRC.
Please go ahead.
So I think that there's still a lot of work to do, because I think, but governments have recognized the complexity of the context. I can speak for Eastern DRC. They are keen to be engaging with agencies who are working in either in peace building or humanitarian world, but I think there's still a lot to do. I also think that there's a lot to do in terms, as I mentioned just before, of working on this confidence building between the government and communities. We're talking about conflict contexts here where there's very little confidence in government responses, unfortunately. So I think there is a need to sort of look at that and take that into account. Sometimes particular responses may be perceived differently. They might be perceived as being a political move or a move to crack down on a particular group, for example. So I would put the emphasis on that. I think there's still a lot of work to do.
Wale, can I jump in?
Yes, please.
Yeah. So local governments are quite important in our context and in our work as well. They are the frontliners in anything, whether that's related to the pandemic or not. And we've made it a point to work with them through the years. I think the restrictions that we talk about in terms of the lockdown, in terms of a national lockdown and hard approach, we've been able to circumvent that because we have access to local governments and they know us. And I think in terms of the Philippines and in Mindanao in particular, the Bangsamoro, they have been an area of change. They're in our structure, the local governments are able to pass ordinances that can respond to the needs of the community. There are ways by which they engage their communities. We've seen some improvements, and we've seen some improvements as well in recognizing what are the different tools and the different skills and knowledge that they need to possess so that they're able to respond better to their constituencies. At least that was what was shown to us through the years, and especially now with local government, with the pandemic. Of course, I'm not saying that all of them are, but there are local governments that are commendable in terms of their approach and in terms of really understanding what is needed in terms of response during the pandemic and after, and looking at what can be done in terms of resources, self-sufficiency, and so on, and better engagement with their constituents.
Thank you, Nikki.
If I come in as well from the Rwandan perspective.
Yes, please. Go on, Betty.
Thank you. As I said earlier, the Rwandan government here, I think, has been really in the front line of doing it, like managing the COVID crisis without actually engaging other partners on the ground. And I think a lot of civil society partners on the ground have been really complaining on government's inability to engage other partners rather than feeling it's a big government business. So we noticed a lot of local partners, local government on the ground engaging different partners from civil society to deliver humanitarian needs. We saw them actually designing the agenda on how to intervene, and actually a lot has always been engaging them to say, wait a minute, yes, we understand you have been really getting money, probably talked about the World Bank and a lot of funds coming from abroad. But then we saw that the formal economy was the one which the government was really targeting that much. And I think our role has always been engaging government, which are at the front line, saying, please go ahead and engage the informal economies. These are where the majority of the population depends on. So our role has been actually really feeding into the agenda and working with them to check. But generally, the local government has been on the front line and doing this very well in terms of delivering, in terms of giving information. Definitely a lot of misinformation has been on the ground, but we worked with them just to make sure that it's really sensitive and that trust is again built, particularly between local government and citizens, as well as the security personnel, which has been really tough in these periods of total lockdown within our context. Thank you very much.
Thank you so much, Betty. And with that, we've come to the end of the event, and I would like to express our sincere gratitude to Nikki, Cindy, Betty, Lucy, and Mike, sharing their thoughts with us. So thank you all for coming and for your questions, and again to all our panelists. If you want to find out more about International Alert's work on COVID and peace building, there's a link that will be posted in the chat below, and you can also visit the website and follow them on Twitter as well. Thank you, everyone. Enjoy the rest of your morning, afternoon, or evening, or in some places it could be night. Thank you all. Bye.